Hi, I'm Laura from Kids Chatter Speech Pathology. We received a question from Carly. My 2.5-year-old speaks with a lisp by pushing his tongue forward and up when saying s. Will he grow out of this? We play games like can you say s like a snake and model putting our teeth together, but he still cannot produce a clear s. So this is a great question, Carly, and something that we do get asked a lot. It sounds like what your son is doing is actually producing a lisp. Now there's 4 types of lisps. One of the main ones, which sounds like what your son is doing, is what we call an interdental lisp. So this means that when they're saying the s sound, their tongue is going through their teeth. So it would sound something like this: Philly snakes. Another type of lisp, which is not as common as the interdental, but still it does occur in children, is what we call a lateral lisp. So this is when the tongue is going out towards the sides of the teeth and air is coming out through the sides of the mouth. So it would sound something like this: silly snakes. So you asked if your son will grow out of this. Now, most kids that are showing a lisp, no matter what type it is, most of them will require some sort of intervention to be able to remediate that lisp. So whether that be just a parent modelling how to say that sound properly for them, or some actual formal speech therapy intervention. So your son, you're saying that he's 2.5, so although it's good to intervene early with any speech errors, he may be a little bit too young to be able to understand the instructions that are used in speech therapy for his lisp. So that could be why when you're trying to get him to say it properly, he's having a little bit of trouble. So it could be a case of just monitoring him for 6 to 12 months. And if he's still doing that lisp, it would be a good idea to see a speech pathologist to have that checked out. The best time to intervene with something like a lisp is usually about 3 to 4 years of age, depending on the child. So they've got to be ready to understand those instructions for the therapy to be effective. And when they are ready to understand those instructions, lisp therapy is quite effective. So if you have an older child though, that's more 4 or older, and they are showing a lisp, then it's a really good idea to see a speech pathologist and get some intervention. So as with most speech errors, what you could do in the meantime is really model the correct s sound back to your son, as it sounds like you're doing. So make sure you're putting your tongue behind your teeth and your teeth together, and making a bit of a spread with your lips when you're doing that s sound.